Monell is nothing more than a collection of really interesting, sometimes quirky scientists and people who are just passionate about what they do. I've had some fabulous collaborations. There's a real sense of family here, and a family that is really focused on understanding something really, really important.
This sort of research could be instrumental in helping us solve challenging health issues, emerging infectious diseases like COVID.
Hello and welcome to American Stories. I'm Saida Pagan. Our guest today is Dr. Valentina Parma. She is the Assistant Director of Academic Affairs at the Monell Chemical Senses Center in Philadelphia. And she is one of the leading voices in the call for universal testing of both smell and taste, which is a movement that has taken on greater urgency since the start of the COVID-19 pandemic. Welcome to our program, Dr. Parma.
Thank you very much, Saida.
What exactly is universal sensory testing? What does it entail and why is it important?
That is a great question. And I feel like we have experienced forms of universal sensory testing. If we think of vision, I wear glasses, and so you might have guessed that at a certain point, I received the smell test. The doctor told me to get my eyes checked. With hearing tests, we have a similar experience, but I bet that the majority of people do not actually have a doctor sending them to have their noses being tested, nor their mouths. And this is a problem because loss of smell in particular and loss of taste are very informative because they are early predictors of several diseases. So recently, there are some studies from Dr. Leon showing that smell dysfunction is linked to 139 different conditions related to inflammation alone. So as you can see, losing your sense of smell does not just mean that you cannot experience odors, but it means that your olfactory system might be degenerating or malfunctioning to a way that is related with many other disorders. And you might want to know that to act early.
Name some of the disorders. Alzheimer's, dementia. Tell us about that.
Exactly. Parkinson's disease, Alzheimer's disease are the ones for which we have the most evidence at this point. But pretty much any neurological disorders has a component that could be related to olfactory dysfunction, multiple sclerosis, schizophrenia, and even psychiatric conditions like depression and anxiety seem to be overrepresented in those who experience olfactory dysfunction, as well as those with depression tend to have lower olfactory abilities. So all of the mechanisms have not been fully mapped yet, but there is a general recognition as per strategic planning of the National Institutes on Deafness and Communication Disorders, Other Communication Disorders, which is an institute at NIH, which funds research on smell and taste, in wanting to have a screening for olfactory function in relation to Parkinson's and Alzheimer's. So for instance, what we know from Parkinson's is that we imagine it and we recognize it as a motor dysfunction with tremor as one of the symptoms. But few people know that at least a decade earlier, you can start seeing olfactory dysfunction emerging that might be unlinked to the motor symptoms that later would emerge. So knowing well ahead of time whether somebody might be developing Parkinson's disease or other forms of dementia will help with early treatment and definitely early diagnosis.
What is the situation right now? How often do people have their sense of smell and taste actually measured? And what is the situation right now?
Situation is not particularly fortunate at this point. There are a few expert rhinologists in the US, but worldwide the situation is not very different. And so having access to expert olfactory evaluations is quite difficult. And so when we talk to patients that might be having some forms of olfactory dysfunction for years, sometimes even for decades, they might not have encountered a specialist yet, or they encounter a specialist very late in their evaluation and diagnostic process. Currently, primary care providers, nurses, scientists are not well trained or educated to recognize olfactory dysfunction, and this misses the majority of people at this point.
So what you're saying is that the majority, not maybe the majority, but quite a few doctors, a high percentage of doctors don't even think to measure smell and taste in relation to other diseases and ailments. Is that correct?
This is what it seems to be happening based on accounts from our patients that really report the stories of not being even understood in their request. And I have personally spoken with many doctors that once presented with the evidence recognize that smell and taste could be symptoms to be either managed better than they currently are, or at least used in diagnostic processes much more than what it is currently happening. But a big problem here is that it takes time to evaluate smell and taste, and visits already are booked with other priorities. And so usually there isn't much time for this evaluation to be considered, particularly if it is also hard to have those tests reimbursed at a certain point.
Now tell us about the movement that's going on right now to change all of that. I know you were part of a very large conference that took place, I believe, in the fall of 2023. Walk us through that.
Correct. So towards the Universal Chemosensory Testing Conference, which was held in Philadelphia, and one of the lead organizers was Monell, we really tried to put together like patients, scientists, clinicians, and even commercial entities interested in the space of olfactory health. And we wanted to act as a united voice. So oftentimes people think that smell dysfunction, it's like an afterthought. It's not a real problem. It's almost equivalent to a rare disease, but this is really not the case. And particularly it is not the case after the COVID pandemic, where millions of people lost their sense of smell temporarily, but also continue to have permanent smell and taste dysfunction after having contracted the infection. And rather than acting as separate pockets of groups, clinicians on one hand, patients on the other hand, scientists, and even commercial entities separately, trying to push for the recognition that olfactory health is important, we decided to get together. And very recently, as early as this past week, we have completed our white paper, which is now a preprint that is undergoing peer review. And we highlight together and through discussion at that conference what are the barriers as well as the opportunities that are in front of us to improve olfactory health and gustatory health by including like a universal chemosensory screening more in the mainstream of research and the clinic.
So walk us through the process with the white papers. What happens after that?
Well, after that, really what the white paper calls for is the connection of stakeholders and at least the three priorities over the next 5 years. So first of all, we need to decide which tests are the standards to be used in connection with different pathologies. So currently we have the well-validated tests that are used for research and in specialized clinics, but time, effort, and even cost to prevent them to widespread use. And so the conference highlighted that there are new tools that have been recently developed in relation to COVID in particular, that will allow to have like screening much more easily available to more doctors if they're interested. But we need to know what it means when we compare the data from this like screening tests that have been recently produced. How do they compare to the standards that have been currently used in research and the clinic? The second point is that we really need to figure out what are the regulatory and reimbursement pathways, because more and more doctors will start using smell testing when this procedure are going to be reimbursed. And for that to happen, we're missing some clear evidence of what are the benefits of smell testing and what are the economic cost reduction that having a smell test earlier on in the diagnosis of the individuals with different pathologies would bring. And so we're currently working to gather that evidence. And last but not least, we really believe that education and public awareness are still very sticking point for chemosensory assessment to become a reality. And this means that I'm working in particular with the National League of Nursing to include smell and taste education into the nursing curriculum. And so help nurses be educated on what smell and taste disorders might look like, how to test for them in a clinical environment, and how to include this information into other type of differential diagnostic processes, as well as public awareness. So I'm very happy to talk with you today and to reach this audience because people still might misperceive smell and taste as an unimportant part of life and something that we could give up if we were forced to. But in reality, when we talk to people that have unfortunately lost the smell and taste, we realize how life loses its colors and flavors, and it's much harder to believe.
Well, as you know, I've done some reporting on this, and I have spoken with individuals who have lost their sense of smell. And in one instance, the person actually was born with lack of sense of smell. And in two other instances, they lost it during COVID-19. So you deal directly with patients as a researcher, correct?
I do.
So tell us what you've seen. Tell us some stories without, of course, naming names. Tell us some stories.
They are very interesting and they're personal. Some people, a couple of stories that really stuck with me. There's a developer of recipes and a chef who lost his sense of smell during COVID. And not only his appreciation for food changed, but his complete career had to take a pivot. And so he tried to develop different ways of training himself, but the sense of smell was not able to come back as quickly. And I heard, privately many more stories for perfumers, from other chefs, from people working in relation with fragrance and food that are not as forward in the workplace with their loss of sense, because it directly affects or might affect their capabilities. And again, there's not a real path for them to seek in the indemnification of any sort, or trying to have the recognition from colleagues and other family members and friends. But what really breaks my heart the most are people that really didn't even consider the sense of smell before, and they were going about their life, and suddenly they don't appreciate going out to dinner anymore because, hey, food just tastes like cardboard now. And so there aren't the nuances of very, articulated, even Michelin star level restaurant dishes are lost because they're not, one dimension of the flavor perception is completely, dissolved. And then they're trying to explain to people close to them what it means to them and the level of the loss that this is. And nobody understands. And the family don't understand. The doctor don't understand. Oftentimes, doctors say, oh, well, you should be glad it's not vision. This could be much worse. So olfaction, we could, let's see if it comes back. And so this is this level of lack of awareness, honestly. And again, it's for lack of education. The chemical senses are very complex, are high dimensional senses, and we're still scratching the surface of how they're working and what they're contributing to our life. But despite this, the people that are losing it are really feeling the loss on a daily basis. If we eat 3 times a day, if not more, that's a painful reminder that life is not as it used to be anymore. And social relationships changes are connected to that. Some people report that their sexual desires have changes, or the connection with a family member, for instance, a child, it's not the same after they lost their sense of smell. So the way these sensory losses affect one's life are deep and profound and very pervasive on a daily basis. And it's a pity that this grief, if you will, is not even recognized.
Now, in these instances that you just discussed, was it as a result of contracting a COVID, or did these individuals have underlying health problems?
So it depends. It's varied, and the end result is very similar. I know of people that lost their sense of smell due to COVID that reported this issue, like the chefs that I mentioned in the story are related to that. But others have lost their sense of smell years back, even a decade back, for other type of viral infections that were not as known prior to COVID. At least COVID really allowed people to lose their sense of smell, mostly temporarily, all at once, and so brought to the attention of the public smell dysfunction like much more than ever before.
Bring us up to date if you have the information as to what is going on, because I know I did some reporting a few years ago and they were trying to find some type of treatment for it. And there were all kinds of things out there, including blood plasma, all sorts of remedies. What is going on right now? Because we don't hear much about it, now that the pandemic is pretty much over.
Oh yeah, I think you really are making a very good point here. I think the majority of people are thinking like COVID is gone, smell loss is gone, and we can forget about it. But it's really not the case. When it comes to treatments, we still don't have like a silver bullet. But thankfully, there are many at work and trying to figure out new pharmacological treatments. There are some treatments right now, like the PRP that you were mentioning, like the platelet-rich plasma that you were mentioning, that seem to have a positive effect in some patients, but not in. We're not able to predict yet for whom these treatments are working the best. When we analyze the data as an aggregate without taking into account individual characteristics, we're not able to see like extremely strong results at this point. So we're being cautious in trying to give hope to patients, but also not leading them astray at this point. Pharmacological treatments are under clinical trial and are being tested at the moment. And I know of a couple of this kind, but currently we're still like having a diagnosis of anosmia or a hyposmia still requires like managing the symptom rather than finding a solution and a cure to it. But I want to really stress that even if like managing the symptoms, it's not like a solution that we might hope or doctors might want to see as the final solution, is still very helpful for patients. And they're highly calling for at least the recognition and the validation of their feeling around this. And this is something that we can start doing from right now without waiting for a therapeutic to be validated and put on the market.
Right. So let's be clear. We have a situation where, for example, individuals have not been diagnosed yet, or they're not sure. And then there's also the issue of treatment. So you said managing their symptoms. How are they doing that? What's the most common way that symptoms are being managed?
Oh, there are at least three ways. We know that people that lose their sense of smell, for instance, they tend to change the way to eat. They tend to eat more salty and more sugary. So being connected with a nutritional provider will help them understand how to set up their diet so that they might not incur in other unpleasant side effects. Or many people report depression or other types of mental health issues connected with the loss of sense of smell. I mentioned grief, but also anxiety, depression. Sometimes this can go on, especially in COVID participants, even to the level of having suicidal thoughts. And this can be addressed with the help of a mental health professional, but oftentimes referrals are not made to this type of providers, even if, because they're not recognized, because the loss of smell is not identified, recognized, and considered by primary care providers, for instance.
So tell us how the universal testing would actually take place. Is it during a physical exam? How would it happen?
Yeah, so that is our hope at this point. Like, we have annual wellness visits, and we could add like a very short smell test that it would not be perhaps comprehensive, but it could highlight, especially if done longitudinally year after year, whether there is a decline. And this would be like a red flag that providers might want to investigate further. So for that to happen, we need to have a test that is akin to a screening test, so that we might have in vision or hearing. It has to be fast, it has to be relatively easy to perform, so that like a vast majority of the population could be administered this type of test. And for the current way in which like wellness visits are conducted, the best way that we can think of is that there is like a test that could be completed during like in the waiting room while waiting to see a provider. So the provider doesn't have to spend time administering the test, but can just look at the results and help the patient interpret the situation. So we are thinking of tests that last less than 5 minutes, that can be self-completed, perhaps through like some electronic aid, and that are quite easy in terms of instructions.
Now, you have already come up with some tests. Tell us about what you are doing at Monell.
We have developed during COVID the Sentinel test, and this test is a screening test. It takes less than 2 minutes, and it tests for 4 olfactory functions. So it tests for the detection of the presence of an odor. It helps identify the intensity of an odor. It helps determine whether you can recognize what the odor smells like and how much do you like the odor. And by combining the responses to these 4 questions, we're able to identify whether people have completely lost their sense of smell, or they are anosmic, they have partially lost their sense of smell, or they are hyposmic, or they have a distortion of the experience of the sense of smell that usually reflects on changes in pleasantness, and this would be called parosmia. And these are the macro categories of olfactory dysfunction. And this would be quite helpful. Like, this test is the shortest test that can evaluate a multiple olfactory function, and it could be self-administered from ages 7 up until more than 99 years old. This test was conceived to really be used at the population level to monitor year after year how people perceive, or the perception of their senses changes.
So where are we right now in terms of, how many people have it, or you've just done research on it, or tell us about, and is it a scratch test?
It is not. It's actually a peel test. So there are stickers that you can peel off, and there are stickers with a smell and sticker without a smell. And then you're asked on a tablet, on a smartphone, on a computer to provide your responses. We have tested more than 6,000 people with this test in research, and now the test is licensed to a company, which is the Hersla Health, which sells it for researchers and clinicians to use. And it's now been included in several clinical trials where we're trying to evaluate olfactory functions across adults, the elderly, as well as children at this point. We're also establishing several translations across the globe. So we have data from Nigeria, the Netherlands, Italy, Germany, Singapore, and etc. So we're trying to provide the test across several languages at this point, and India as well. This is our most recent country connected with the Sentinel test.
Going back to the COVID issue, do you have any idea of what percentage of individuals who lost their sense of smell have actually regained it? Because I know at the time I was doing the story, it was just, a few years after COVID, and they had not regained their sense of smell, some of them. So do you have any idea where we are in America or even globally?
Yes. Well, we know percentages, and again, this estimates tend to be underestimations of the real problem. But what we do know is that up to the Delta variant, so in the first year and a half, 2 years of COVID, up to 70% of people lost their sense of smell, and 40% of people lost their sense of taste. This went down, going down to 15% and then 5% in Omicron more recently when it comes to smell. But still, 5 to 10% of these people actually have persistently lost their sense of smell and have not regained it since. So we're still hearing from people who lost like their sense of smell during Alpha, during the Delta variant, and even during Omicron that have not been able to regain their sense of smell or taste. Why is this happening? Why some people recover and some others don't? We do not have the final answer to that. There might be, and some studies indicate that there is a genetic component, but it seems to be minimal. And the suggestion is that there are inflammatory mechanisms that seems to be heightened persistently in those that have not regained their sense of smell. We're trying to test this in the lab to confirm or deny whether this is one of the mechanisms that separates people who lost their sense of smell during COVID persistently or not, but we do not have the final answer yet.
I would think individuals who are in that category or have friends or family members in that category would be very interested in your research. And I know that some individuals I've spoken to actually have been participants. So if an individual wants to participate, what should they do?
They could connect with www.monell.org. There is a tab with a participant's request to participate in research and express their interest there. You would find like our studies advertised there. And we would really welcome your participation in our studies. It is very important, and particularly for people that have lost their sense of smell, to participate in these studies because they will allow us to identify a good method to identify people that lose their sense of smell. I know it is also quite frustrating, and so I very much appreciate those who would like to donate their time to research in this way.
And what about obtaining one of these kits, these smell kits? What do they do?
So, for this to happen, you need to be a researcher or a clinician at this point, but there are some demo cards that could be requested at a HRSA Health on their website, and they would be able to send like copies of the current test or trial cards to understand how the test might look like.
And finally, if people are interested in following what is going on with this universal testing, where can they go to find out that kind of information?
There are a couple of places. You can follow the Monell website or LinkedIn account, Instagram, Facebook, depending on what you are mostly used to. Or you can also follow the Breakthrough Consortium for Olfactory Health. So this is a recent consortium that I'm co-chairing with Duncan Boak, who is the CEO of Fifth Sense, and it's a charity for patients with smell and taste dysfunction. And this is a cross-sector effort. So we're really working with companies in the diagnostic world, as well as in the therapeutic world, as well as with clinician scientists and scientists to put together a roadmap to show what are the benefits of smell function.
So there could come a day when you'd go for your physical exam that a smell test and a taste test would be part of that. Is that correct?
This is my hope and dream, and I hope to, for that to happen very soon.
Well, thank you so much for all you do, Dr. Parma.
Thank you, Saida, for this interview and for sharing information about olfactory health.
And thank you for joining us for this edition of American Stories. I'm Saida Pagan.